We are going to discuss about idiopathic thrombocytopenic purpura. So let us first know what is ITP. So as the name suggests, it is an immune mediated thrombocytopenia. So in this condition there will be antibodies which will be developed against the platelets. So the platelets will be destroyed, leading to thrombocytopenia. So now moving on to subtypes of ITP. So the ITP is mainly of two types, that is acute and chronic. So now let us discuss each condition one by one. So let us now first discuss about acute ITP. So it is the condition which have short duration history, and it is usually severe, and it will have sudden onset, and it is most commonly seen in children, and this condition is usually associated with the history of viral infection. And now moving on to chronic ITP, it is a condition which have long duration history, and it is usually less severe, and it is most commonly seen in adults. And the chronic ITP is mainly of two types, that is primary and secondary. So the primary type is usually idiopathic, and the secondary type is usually associated with the conditions like SLE, HIV and chronic lymphocytic leukemia. Now that we have discussed about the subtypes of ITP, let us now discuss the pathophysiology associated with this condition. So in ITP what happens is there will be antibody formation against the platelet antigen. Like you can see in the picture, there will be antibody formation against the platelets. So when these platelets combined with antibody are released into circulation, there will be splenic phagocytosis which will take place. So the main pathophysiology associated with ITP is there will be antibody formation against the platelet antigens. So when the platelet associated with antibody are released into circulation, there will be splenic phagocytosis which will take place. Now that we have discussed about the pathophysiology, let us now discuss the clinical features associated with this condition. So the main clinical features are Petechiae, Purpura, and there will be presence of hemorrhagic bullae, which are more common in acute type of ITP. And the other clinical features which can be seen are gum bleeding, hematuria and melena. And the most important characteristic feature associated with ITP is there will be normal size spleen in thrombocytopenic purpura. Now that we have discussed about the pathophysiology and the clinical features, let us now see how to go about the diagnosis of this condition. So this condition is usually the diagnosis of exclusion. So when the clinician excludes the conditions that are associated with thrombocytopenia and doesn't come to any conclusion, the condition is usually identified as ITP. The other findings which can be seen are there will be decrease in platelet count and increase in bleeding time, but there will be normal prothrombin time and activated partial thromboplastin time. And the other important finding is Coombs test in this condition will be positive because of the presence of antibodies. And now coming to bone marrow examination, bone marrow is usually active and there will be megakaryocytic thrombocytopenia which can be seen. Let us now see how to go about the management of this condition. So in acute type of ITP, symptomatic treatment is usually given, and in case of chronic conditions, steroids and IV immunoglobulins and splenectomy can be